Good morning. My name is Emma Sarton, and I will be presenting on behalf of my colleague Mark Smith and myself on the challenge of inclusive education and our experiences of implementation, in particular in Eastern and Southern Africa. This experience comes from many varied working contexts. We both started life out as teachers in the UK and also abroad, with a particular focus on quality first teaching in a mainstream context. We have worked in international development and then set up EnableEd, which is a community interest company where we develop programming in quality first teaching and inclusion, conduct research into best practice of IE and school improvement, as well as the M&E of education programming. Both of us have been engaged on a practitioner level for years and feel very fortunate that we can operate at the intersection between research, M&E and programming, as we feel that they inform and enhance the practice of these areas, resulting in the greatest positive change in the lives of children. We have worked on issues of equity through a focus on education access, engagement and quality in countries like Ethiopia, Uganda, Rwanda, Nigeria, but also Iraq, Syria, Afghanistan, and in the UK too. While all of these contexts are different, we believe that there's a similarity in the approach that can be taken to improve education for all children, and that is through the provision of quality first teaching. This presentation highlights what we have learned from programming, training, research, and evaluation. I will start by identifying three tensions within the inclusion debate that inhibit and constrain the journey towards more inclusive schools and better educational experiences for disabled children. Then I will move on to provide a practical model that aims to reduce these tensions that teachers, schools and ministries of education can use to create more inclusive education opportunities. I will conclude with a summary of the implications for the model at different levels within the education system and ways forward. I think for us, the current conversation focusing on quality sometimes assumes that all children are accessing school. But despite the right to education for all being enshrined in myriad national and international treaties, issues still remain for children with disabilities in being able to access education, being socially included in education, and experiencing quality education. If we take the UNESCO 2012 disability prevalence rate in populations to be between 10 and 16%, we find a shocking disparity where the reported number of children with disabilities in schools is much lower. Our work on using national datasets found that in Uganda, children with disabilities comprise 1.79% of the total school enrolment, 1.1% in Rwanda, and 0.7% in Ethiopia, indicating the large number of children with disabilities which are not in school. Moreover, this gap in enrolment widens as boys and girls with disabilities progress through educational phases, highlighting the fact that serious attention is needed to ensure learning opportunities for all. In addition to these gaps, there is also a lack of research into what works in inclusive education in Eastern and Southern Africa. So given the deficiencies in the education provision for children with disabilities, the financial and human resource constraints present in many countries, and the discourse surrounding the definition and scope of inclusive education, this webinar will present a practical and pragmatic approach to increasing inclusion for both boys and girls with disabilities. Our work has involved working with international partners, NGOs, government, schools, parents and children, and throughout this we have seen that three main tensions exist that prevent coherent inclusion policies from being created and implemented on a school level in many countries. The first is aspiration rather than action. Most countries around the world are legally obliged to provide inclusive education, primarily as a result of the Salamanca Statement in 1994 and the signing of the Convention on the Rights of Persons with Disabilities in 2006, which effectively tied inclusive education to the Education for All agenda. These commitments not only include the right of all children to attend a regular or mainstream school, but also to access a child-centered pedagogy capable of meeting their needs. However, as we approach the 25-year anniversary of the Salamanca Statement next year, we still see that despite the clear legal imperative, in most parts of Eastern and Southern Africa, inclusive education is legislated for rather than planned for. The second is theoretical versus practical. Another element that prevents inclusive education policies from being designed and implemented is the theoretical discourse that frames inclusion and people's attitudes towards disability. We are not suggesting that a discussion on theoretical models is not important, rather the discussion itself prevents a move towards implementing practical applications which result in educational change today. For example, the medical model sees disability as an issue relating to the child and not the environment in which they are, which results in a deficit approach towards disability and inclusion. The persuasion and re-education of those who see disability in medical terms takes time at the expense of the education of children with disabilities. The question that needs to be addressed is not whether to include children, but how to do it effectively and in a timely fashion. The third tension is a lack of cohesion. The term disability covers a multitude of different needs, which can vary enormously from child to child. This gives rise to many groups who lobby for specific and unique interests, which can have the unintended consequence of making the design of inclusive education policy a lengthy process, which can result in delaying implementation. There is a real need to find a mechanism where various groups can come together effectively without the need to compete in order to collectively create and influence policy. So the tensions outlined can make the prospect of improving inclusive education provision daunting and make it hard to even identify where to begin. We have used a wave model in inclusive education programming and research as a response to these tensions and the barriers which are created. The wave model was developed in the UK and reflected the challenge schools were facing in meeting the different needs of children with disabilities. The wave model proposed a graduated response in which the child was at the centre. The response started with the universal, i.e. what was available for all, and then to move to the targeted, the additional support that children needed to access the universal, and then to the specialist, highly tailored intervention to support children to reach their potential. We found little evidence of this graduated response in our work in Eastern and Southern Africa. What we more commonly observed was an ad hoc approach usually characterised by a universal offer, with children with disabilities expected to fit into what was available for all, and then for a select number of children with disabilities, a specialist approach. This led us to develop a more pragmatic approach to inclusive education using the WAVE model to provide an accessible framework for ministries of education and practitioners to use in order to plan practical steps for inclusive education implementation. So this diagram shows the WAVE model. It's important to note that this WAVE model is not a one-size-fits-all, and the interventions listed here are based at the point of need and in relation to the availability of resources. Key to this is supporting schools and governments to make their own choices about interventions. The interventions listed here are examples of what we have seen that have been successful in making education more inclusive. The strategies are not necessarily new, however. They are reframed in a way that allows schools and ministries to identify what they have already achieved and what pragmatic steps need to be taken to support all forms of disability. Most education ministries have, in some way, shape or form, implemented strategies found in all of these three waves. However, many inclusive education interventions only focus on highly specialised Wave 3 strategies or attempt to implement targeted Wave 2 strategies without first achieving some of the quick win actions that make mainstream teaching more inclusive. It starts with Wave 1, where the strategies focus on mainstream classrooms and are predicated on the understanding that educating children with disabilities can first be done by improving teaching and learning for all children. Thus, this first wave focuses on the majority of mainstream teachers and aims to dispel the common assumption that teaching boys and girls with disabilities requires extra disability training and skills. To support inclusive education, the role of the classroom teacher is to deliver high-quality teaching. Doing this will benefit all learners, including children with disabilities and children with special needs. Wave 2 of the model recognises that children with disabilities have the potential to work at and above their peers, but to do so they will need direct intervention which is time-specific. Wave 2 strategies are not to be seen as sequential to Wave 1, but rather running in parallel and are primarily in place to support children to access the mainstream quality teaching implemented in Wave 1. Finally, Wave 3 interventions recognise that some specific complex impairments make it impossible for learners to achieve at the same rate as their non-disabled peers, and as a result, different provision is needed. This is where more specialist strategies come into play, albeit though for a smaller number of children who have severe disabilities. In terms of Wave 1, quality first teaching for all, without doubt, two significant challenges are large class sizes, in some cases of 100 plus, and limited resources, often just a blackboard. However, the key issue is not the quality of teaching of children with disabilities, but the quality of teaching for all children. The vast majority of lessons we have observed were teacher-led lessons, where the teacher either lectured or asked questions which children would answer through raising their hand, with minimal participation, and in only some lessons were teachers using learning aids, other than a blackboard, and in far fewer lessons were learners using the learning aids themselves. There are a couple of areas that have demonstrated huge gains for learners. The first of those is increased group work and child-to-child work. So increasing the amount of opportunities that learners have to work in groups or pairs in the lesson is vital for inclusion. For example, allowing time when a question is asked for students to turn to the person sitting next to them and share their answer. All children have answered the question, not just one. Less able children have learned from more able, and less confident children have had the opportunity to orally rehearse their answer. The most effective teaching process most often observed was the teacher modelling how to answer questions, and then the students doing the same independently. In addition, group work fosters social inclusion and builds a welcoming ethos. For example, in a school in rural Uganda where significant amounts of group work were observed, children with disabilities were integrated into friendship groups and playing together with their non-disabled peers during break and lunch times. The second is the improved use of learning aids made out of locally available resources. In the vast majority of lessons, the absence of learning aids results in learning being abstract. Where learning aids are used, it supports learners to gain a more concrete understanding of the concepts and enables the vast majority of children, including those with special needs, to access the learning objectives. Examples observed include using counting sticks in mathematics to support an understanding of basic operations, and this picture here shows the use of bottle lines to model the blending together of sounds to support reading. Non-specialised materials can further support children with disabilities. For example, mini blackboards allowed teachers to give a spelling test of the children in their class. The visually impaired children orally spelt their answer to a supported buddy, who then wrote their answer for them on a mini blackboard, allowing the teacher to assess if the visually impaired children knew the answers. We have observed that much work on disability, both at a national and NGO programme level, focuses on enabling children to access school and not on the quality of the learning. Teachers often express reservations around inclusive education, primarily because they believe they do not have the necessary skills to teach children with disabilities. Underlying this is the assumption that boys and girls with disabilities need something different in the classroom. Sometimes disability programs actually exaggerate and exacerbate this assumption further by training classroom teachers in Wave 2 interventions, such as the use of sign language or braille. We believe that this is not the role of the mainstream classroom teacher. To support inclusive education, the role of the classroom teacher is to deliver high-quality teaching. Doing this will benefit all learners, including children with disabilities and children with special needs. Wave 2 interventions can be split into three areas, that of access, engagement and quality. In terms of improving access, so getting children with disabilities into school, two areas have proved fruitful. One of those is the use of data in schools and nationally. On a school level, use of data allows head teachers to effectively target groups of children and track progress. On a national level, an exploration of data allows investigation into issues around disability in terms of both scale and geography, and then subsequently target gaps. There are a number of key points that have been revealed through the examination of data, two of which are the degree of missing children, which is the discrepancy between the percentage of children with disabilities enrolled and the prevalence rate. This could be because the children are not accessing school, or that they are accessing school but not identified as disabled. The reality is a mixture of both. And the other one is variation with disability groups. National data indicates that certain groups find it harder to access school. So, for example, children with multiple impairments, females with physical and multiple impairments or learning difficulties. Additionally, national data also shows an issue with transition, and in that it's not occurring for children with disabilities. A second area that helps improve access is working with parents. So a common perception is that parents and communities' negative attitudes inhibit their children with disabilities from attending school. However, throughout our work, an alternative view of parents has emerged. Parents of boys and girls with disabilities want their children to attend school but feel that they will suffer from bullying and the school will not be able to provide the level of care and education that their child needs. This feeling by the parents of the child being better off or safer at home is not really reflected much in the literature, and programming will often have many sensitization elements aimed at persuading parents to change their attitudes rather than listening to their concerns. In many contexts, we have found a link between the presence of an active parent support group and increasing numbers of children with disabilities in school. Example of best practice included PSGs that conducted community visits in order to encourage other parents to enrol their children into school or follow up on dropout. Particularly successful examples also included income generation activities. Thirdly, the improved identification of disabled children in school means that when schools are trained and resourced to begin the process of carrying out screening of their students, there is the potential to significantly increase the amount of identified disability in schools and act on that. This was most effectively seen where a referral system existed as a partnership between health and education services. The second area of engagement and ethos is that we believe that work to change attitudes that is traditionally facilitated through sensitization and awareness training, while important in some cases, does not drive change in attitude towards disability. One of the most striking pieces of learning is that the strongest advocate for inclusion comes from the physical presence of children with disabilities in educational settings. Both teachers and children without disabilities report that their notions of what people can and cannot do were challenged. Many teachers that we have interviewed felt that before they had taught a child with disabilities in their classroom, it was somehow impossible to do so, and they lacked training, skills, and confidence. And there are a couple of ways to tackle engagement. The first is signage and making the physical environment more accessible for disabled children. So despite finance being a barrier, there are easy to implement and cost-effective adaptations that can be made. Many disability persons organisations lamented the lack of Build Back Better discussions that made it into legislation. For example, constructing ramps rather than stairs, which has no more cost implication, it just needs to become usual practice. Signage can have a huge impact on the environment and raising awareness. Schools which are successful in engaging students will encourage staff and students to design these, making the conversations around the signage the actual learning. Secondly, the setting up of disability clubs has proved very successful at strengthening the role of both girls and boys with disabilities to improve their social interaction and facilitate their integration into schools. Clubs also carry out disability awareness and prevention activities within the school and community. The most successful ones also carry out income generation activities, for example, the development of school gardens to grow vegetables. In terms of improving quality, Wave 2 interventions around the quality of education directly support the learner to access Wave 1 quality first teaching. At a basic level, this could be through the provision of an assistive device, such as a pair of glasses or a hearing aid to enable a child with partial impairment to access learning. Partnership with medical services or NGOs is essential for this. Other Wave 2 interventions can involve additional support, for example, the provision of a sign language interpreter in lessons, or the organisation of additional tutorials either outside of the classroom hours or via withdrawal from some lessons for a specified week. Coming to Wave 3, there is little doubt that Wave 3 interventions, often in the form of a unit within a school to support children with complex learning disabilities, have a vital place in inclusive education. However, there are some prerequisites for units to work effectively. The children accessing these units have a disability which prevents them accessing mainstream learning. Teachers provide a varied curriculum, which is monitored by the head teacher to ensure it is being accessed by children. Opportunities are provided for children in the unit to integrate with other children, for example in gardening projects, drama or in PE. And teachers have an understanding of the next steps in learning for each child. Key to the success of Wave 3 interventions is someone responsible for leading on inclusion. However, this is not always a realistic expectation, as there's usually a very limited group of teachers qualified in special educational needs and disability. And if schools do have such a teacher, they can only carry out a limited number of activities and prefer to support children in their unit. This can mean that the SEND teacher could be seen as a potential barrier to inclusion rather than the facilitator of inclusion. Our work has identified two main areas as barriers to effective SEND teacher provision. Number one is the perception amongst SEND teachers can be that their training focused on running a unit rather than being a facilitator of inclusion, and that they need to develop this role. And secondly, SEND teachers can be overwhelmed with the huge challenge of supporting a large number of children with disabilities in different year groups. We would also argue that there's a place in Wave 3 interventions for special schools. The special school sector has been marginalised in the debate around inclusive education, as they are seen as redundant in the fully inclusive education system. However, for inclusion to work, the special school sector needs to be engaged and working with mainstream schools for the benefit of children with disabilities, especially in the arena of providing suitable education that is not just vocational, but also supports particular kinds of disability. Examples of best practice include heads of special schools working with mainstream schools in the same catchment to ensure children can move between them when necessary. So, conclusions. So, in drawing this to a close, inclusion is not a simple one-size-fits-all intervention that can be implemented in schools. Rather, it is a response to the population that the school serves, and interventions are along a continuum. Concepts surrounding progressive universalism are very much present in the WAVE model as schools become progressively more inclusive, enabling all of their school population to achieve. It is clear that schools are working hard to provide inclusive education, but they are largely ad hoc and in isolation from each other. When effective, they are also supported by or have been initiated by an NGO working with the school. However, not one example of a school that effectively carried out all three waves of intervention was found. There are implications for inclusion at every level of the education system. So on a central level, the WAVE model allows governments to link inclusive education with quality teaching for all, Wave 1, and free up SEND experts to focus on Wave 2 and 3 interventions. If Wave 1 quality first teaching for all was the emphasis, many more children would experience a positive change in the quality of their education. This also represents value for money in that it tackles the greatest number of children. There is no specialist pedagogy or equipment to embed in schools, and it builds on the capacity of one of the most important elements of the teaching and learning process, the teacher. Moreover, it can be built into existing teacher training provision. On a district level, for the WAVE model to work, the key is teachers with responsibility for inclusion and a new way of working in an inclusive setting. District leaders need to ensure that SEND teachers are allocated strategically and given non-class teaching time to timetable the interventions, and head teachers and school inspectors need to monitor this and ensure it is working effectively. The accessibility of schools and infrastructure needs to be monitored and ensure that children with disabilities are being considered. On a school level, so much of the discussion has been at a school level, but what the WAVE model can do for schools is provide a roadmap for future interventions. It can show how inclusion is possible and how it can be done. It can also help a school prioritise and support decisions in relation to spending their SEND budget, where available, or eliciting support from parents' community and identifying next steps. So furthermore, international partners and NGOs play a critical role in reinforcing, supporting and supplementing central district and school level services. So on an NGO level, alignment between NGO programming is largely missing, and NGOs tend to work on only one of the waves. There is a need for partnership to maximise impact. So for example, NGOs who are working on Wave 1 interventions need to work in partnership with NGOs who are working on Wave 2 interventions, as this would generate greater holistic change. It would also generate greater efficiencies, as it would allow programming to capitalise on the skills, knowledge and presence of others. Value for money is an area that NGOs can potentially work on, as disability programming can have high costs per school and individual, resulting in a relatively small number of schools being supported. This has significant impact on their potential to scale up across whole districts and across countries. Considering the high numbers of schools, it could be argued that a more cost-effective model of practice needs to be used, focusing on interventions that have low unit costs. And then finally, at the level of international partners, especially UNICEF, there is a clear need for higher level collaboration to support the coordination of efforts to realise the potential of the WAVE model, in particular supporting and bringing together partners who specialise in different WAVE interventions to create a more cohesive model. So for example, those working in access, engagement and quality. In addition, overview and insight at the level of international partners can collate evidence and address some of the tensions outlined at the start of this webinar. Generating an evidence base that is accessible and shared among actors from schools to governments can also reveal cost-effective interventions that can be scaled up. Lastly, international partners can also champion the learner and keep them at the centre of the interventions, resulting in inclusive education for all. It is clear that when children with disabilities access educational provision and are engaged meaningfully in this process with quality teaching, then their outcomes are enhanced. These are not only academic outcomes, but ones also relating to socialisation, health, future economic potential and cohesive societies. So when policymakers, planners, schools and communities understand differences within the student population, this helps to promote social equity and leads to more inclusive societies. Thank you so much for listening. I hope this presentation has given you some food for thought. Thank you.